The government has pledged nearly £450 million to improve NHS emergency care in England. It says hundreds of thousands fewer patients will face long A&E waits as a result, but it hasn't committed to a timescale for ending what it called corridor care. Our health correspondent Rebecca Barry heard from medics and patients at the Royal Berkshire Hospital in Reading.
This morning at this hospital in Reading, there was a 9-hour wait to be seen in A&E. All 30 beds full, with one person waiting outside in an ambulance for an hour before they could be handed over. And this, a relatively quiet summer's day.
So, Mr. De Silva, everything looks fine.
Hence today's long-awaited government plan to tackle the so-called corridor care crisis.
7:30 this morning.
83-year-old Rosemary's being taken for a chest x-ray. She called an ambulance in the early hours of this morning with chest pain, a worrying time for her daughters.
We were very lucky that the ambulance came very quickly. That's not always the case, because if there's not a bed to deliver the patients to, the ambulance has to stay outside with the patient in the ambulance before they can drop them off. So I'm not sure what the answer is, but it's certainly not a quick fix.
The government's promising £450 million to improve A&E services in England, 40 new walk-in clinics to free up space in A&E for those with life-threatening emergencies, 500 new ambulances, 50 new mental health A&Es, and league tables so the public can compare A&E departments. The political pressure to tackle the crisis in emergency care has been mounting. Last year in England, 1.7 million people waited more than 12 hours in A&E, linked to thousands of avoidable deaths. So whilst most welcome today's plan, some say it doesn't go far enough. Under the plans, 10% of patients would still face A&E waits of more than 12 hours.
The government's announcement is not quite ambitious enough, but it's a starter. If you ask us on the ground, we don't want any of our patients waiting 12 hours. The moment we've made a decision, they are stable to be moved on. They need to be moved on. It's undignified for any patient to be in the corridor. But then the moral injury that causes to staff is profound.
The backlog here is often caused by delays discharging patients because of a lack of social care. Political opponents say without tackling that, the misery in our A&Es will only be prolonged. Rebecca Barry, ITV News.